Hello everyone. Today's topic is tubal factor infertility. What is a tubal factor infertility? Tubal factor infertility refer to the failure to conceive due to structural or functional abnormality of the fallopian tube. It accounts for 25 to 35% of female infertility cases and contribute to both primary and secondary infertility. Normally, fallopian tube are responsible for what? Responsible for ovum pickup after ovulation, fertilization in the ampullary regions, transport of the zygote to the uterine cavity. When tubes are damaged, fertilization and transport are impaired, resulting in infertility. जब ट्यूब डैमेज हो जाती है, then fertilization में और transport to zygote में difficult हो जाता है. What are the causes of the tubal damage? Pelvic inflammatory disease, which is the most common in the Western world. Genital tuberculosis, which is a major cause in India. Post-surgical adhesions, which is occur after pelvic or abdominal surgery. Endometriosis causing peritubal adhesions and distorted anatomy. Hydrosalpinx, which is fluid-filled dilated tubes, toxic fluid reflex from tubes leads to lower IVF सक्सेस. जो ट्यूब में जो फ्लूइड्स होता है वो टॉक्सिक होता है फॉर द जायकोट इम्प्लांटेशन. दैट इज वाई आईवीएफ का जो सक्सेस रेट होता है वो कम हो जाता है. कंजेनाइटल एनोमलीज is a rare case. For the diagnosis, a stepwise approach is followed. Screening test which is done in OPD basis. कौन से स्क्रीन टेस्ट कर सकते हैं? Such as a hysterosalpingography in which X-ray with contrast is done. Hysterosalpingography, contrast sonography, which is USD based and radiation free. But the gold standard is diagnostic hysteroscopy with chromoperturbations, which detect adhesions, endometriosis, and allow the simultaneously हम ट्रीटमेंट सेम सिटिंग में हम ट्रीटमेंट भी कर सकते हैं विथ डायग्नोसिस. एडवांस रिसर्च टूल्स सच एज फेलोपोस्कोपी एंड साल्पिंगोस्कोपी आर डेवलपिंग स्टेज and has limited use. Okay, now the treatment depend on the site and severity of tubal damage. If hydrosalpinx is there, then salpingectomy or proximal occlusions before IVF improve the implantation and pregnancy rate according to NICE guidelines, SEOG, ASRM, and Cochrane reviews. If proximal block is present, then hysteroscopic cannulization or tubal recanalization may be restore the patency. If distal block or femoral damage is there, then IVF is the treatment of choice. In the short, if patient has mild proximal disease, the good prognosis with recanalization. If patient is severe distal fallopian tube disease, then IVF gives the better outcome than surgery. If patient has hydrosalpinx which is untreated, then IVF implantation rate drops by the 50%. So NICE and RCOG recommended salpingectomy for hydrosalpinx before the IVF. That is the good decisions. Good Cochrane meta-analysis confirm that improve the IVF outcome after salpingectomy or occlusions. The earlier we diagnosed and intervenes, the better the outcome for our patient. With the modern diagnostic and evidence-based management, tubal infertility can be effectively treated. Hydrosalpinx must be addressed before IVF. The message is with modern diagnostic and evidence-based management, tubal infertility can be effectively treated. Hydrosalpinx must be addressed before IVF and timely referral is must. Thank you.